Today we're going to continue our discussion of respiratory physiology. We're going to take a closer look at the lungs. As we learned in the previous video, humans have two lungs. The lungs are located in the thoracic cavity, and they are separated from the abdominal cavity by a muscle called the diaphragm. The thoracic wall surrounds the lungs and the heart. The lungs have two membranes that protects them. An inner membrane called the visceral pleura that is attached to the lungs, and an outer membrane called the parietal pleura. Between these two membranes is the intrapleural space that has a little bit of fluid which lubricates the two membranes. The transpulmonary pressure is equal to 4 millimeters of mercury. The intrapulmonary pressure is 760 millimeters of mercury, which is the same as the atmospheric pressure. However, the intrapleural pressure is slightly less. It's 756 millimeters of mercury, and this slightly less pressure, or as we may say, negative pressure, allows for inspiration to occur. Boyle's law states at constant temperature, the pressure of a gas varies inversely with its volume. So P1 V1 is equal to P2 V2. What this basically means is that pressure is inversely proportional to volume. So as pressure increases, volume decreases, or vice versa. As volume increases, pressure decreases. So now let's take a look at inspiration. During inspiration, the chest cavity expands. So what happens is that the diaphragm contracts downward and the volume in the chest cavity increases. So according to Boyle's law, as the volume increases, what happens to pressure? Pressure drops. And this is called the negative pressure mechanism, which allows for inspiration to occur. So remember, pressure always goes from high to low. Since the pressure in the intrapleural space drops, it causes the air molecules from the outside, from the environment, to move into the lungs, and hence inspiration occurs. Expiration is the reverse of inspiration. So as the chest relaxes, the volume of the chest cavity decreases. So what happens when volume decreases? According to Boyle's law, since volume and pressure are inversely related, as volume decreases, pressure increases. And what did we say about pressure? Pressure moves from high to low. It always moves from high pressure to low pressure. Hence, if the pressure within the lungs has exceeded the pressure of the atmospheric pressure, then what happens to the air molecules within the lungs? They move out and expiration occurs. Thank you for tuning into Biology Made Simple. Please don't forget to subscribe, like, and comment.